Doctor, recently there was a news article about this lady who was on her own. She has started drinking this bitter gourd juice every day on an empty stomach for some sugar or some complication she had. Then it seems after a while, one day she had that bitter gourd juice and she collapsed and got into health issues, into serious trouble. So, can you let us know why it is not advisable to take up this kind of strong treatment without doctor's guidance? What happens to the body actually when a person goes on having this very bitter juice and empty stomach in a therapeutic doses every day?
Right. It's a very valid and very interesting question, and that every person should understand this basic concept. See, when any drug or medicine or herb or even food is acting on the body, that means it can have its effects and side effects as well if we don't know how to use it. Not just for chemical medicines. Effects and side effects are there for everything what we consume. Provided we don't take it as recommended or as the body's situations are, the drug or herb or even food can affect us adversely.
Yes, just even like common salt also, if you have too
Yes.
much, it causes blood pressure, like
Correct.
that.
Likewise, any herb, it has its own dosha action. That means it can reduce one dosha. Dosha is energy in the body. Yeah, there are three basic energies which control all the functions in the body. They are called as three doshas in the body. So every herb also has action on one dosha. It may reduce, another dosha may be aggravated by it over the period of time. So if a drug or medicine or
Let's take bitter gourd only as example.
bitter gourd can reduce kapha, that is the water or sugar or anything that can nourish the body can be reduced by bitter gourd. So it depletes body from nutrition basically. Yeah, so it can aggravate vata in body. That is, it can cause degeneration or malnourishment or muscle wasting and things like that.
The imbalance is created.
Imbalance is created if it is taken for too long and in that particular dose, which is a therapeutic dose, and without monitoring what doshas are being balanced or out of balance. So the same can happen with any of the medicine or herb or food.
So, if we take bitter gourd as an example, normally people have it in the food, say once or twice a week.
Yeah,
They have that's a culinary, that's the regular use.
correct.
Then if you start eating it every day, or it becomes more powerful effect is there.
Correct. Yeah.
And then if one is making a pure juice out of that and then drinking on empty stomach, it's a very powerful, potent decoction it becomes.
That's right. And it can go on reducing your tissues, so shrinking your tissues. That's what I can, in an imaginary way, I can explain. Like it goes on increasing and drying up your body, increasing the wasting of tissues and drying up of body. That will happen.
So how will one know that what is if we are how do you
When to stop?
when to stop?
start.
Yes.
Yeah, that is where we need to understand vata, pitta, kapha, these doshas, how to assess them, what are the clinical features manifested by one's aggravation, and all those. That is where the doctor's help will come. Doctor will have studied that and will have observed in so many patients what happens when vata is aggravated, what happens when pitta is aggravated, like that. So we observe all those things. That's why when you sit for an
So all
Ayurveda
these home remedies, it is best to consult somebody.
yeah, if it is not for a short duration.
Short, and how many? What is the short duration? How many days would
Maximum is a week.
you say? 1 week.
1 week.
So
Anything beyond 1 week, it's better to consult.
So if somebody is having something like bitter gourd juice or any of the common food item also, if trying to get medicinal effect out of it, better to not do more than 1 week at a stretch.
Yes.
And then best is to consult an Ayurvedic doctor or a physician and only then take up these kind of
That's right.
interventions.
That's correct.
And better to just have it as part of the food. In that case, it is balanced.
Yeah. Very occasional is different from a therapeutic way of taking.
Okay. Thank you, doctor.
You're welcome.